Doc, I don't think I can make it over there, man. I've never been in this much pain before. Hi, I'm Dr. Peters. Have you ever been in that kind of pain where you literally couldn't take your next step? Well, let me tell you something, man. I have been in that kind of pain. And it's one of the reasons why I'm a chiropractor today. As a matter of fact, it was about 2.5 years ago. I was sitting, minding my own business, and I go to get up, and my hip completely gave out. I fell to the floor. And I laid there, and I was in so much pain, I literally couldn't get up. And 30 seconds before, I was fine. I wasn't hurting. Everything was just great. And it just, boom, it went out. And if you've ever had this happen to you, it almost seems unbelievable. Even when you're in the middle of it, you're just like, why? Why is this happening to me? Well, this week's Optimal Health University is about steroid injections. And a lot of people, when they're in that type of pain, that might be their first thought. Man, maybe I need a shot. Maybe I need surgery. What the heck is going on? And people can be angry. They can be scared. They can just be frustrated because they're having this type of pain and they don't understand it. And you got to remember, doctor means teacher or educator. So it's the doctor's job to educate the patients. Here when you come in as a new patient, I got those 10 videos that go out, but they're 2 to 3 minutes in length. And it just starts educating people because we want people to be able to think for themselves. We want people to know what some of their options are in getting better. And some people are medicine bashers. I try not to be that way because I know people who've maybe had some heart issues and medicine has saved their life. And if you're in a lot of pain and you can take something because you've broken something, this medicine has its place. And now I don't like sometimes people will abuse different things. They're doing too much of it. They take too many. People are taking. I take Motrin. I'm taking that. 3 times a week because they have headaches or something like. It's like, oh my gosh, we could do so much better than that. So, if you've ever been in that kind of pain, or somebody who gets into that kind of pain, the idea would be we can try some manual therapies first. Try something like manual therapy, massage. People, now if you're in that much pain, obviously yoga or something like that. Once you get better, then start doing yoga. Massage, usually if someone's in pain or if something comes up, that can make such a big difference for people and help them move in the right direction. So if you've ever been in that kind of pain, and I've had patients I've recommended, man, with the amount of pain you're in, why don't you get some type of medication, meaning like a corticosteroid injection or something to that effect, to reduce that pain. Because, I've had people come in who literally couldn't lay down on my table. And, I don't want to see people suffering like that. Pain is fantastic because it's a great indicator. It tells you things. But being in pain, not the greatest feeling. So if you know somebody, and again, even if pain isn't that dramatic, right? It doesn't mean that, why not take care of it when it's not as bad as it could be? So think about that. If you know someone who could use some adjustments or massage, we'd love to hear from them. And like us and subscribe on YouTube and Facebook, Instagram, all that. If you have any questions, email me, Dr. Peters. It's drpeters@peterswellness.com. Have an awesome